Jada, and I will be presenting today on a grade 2 lateral ankle sprain. So the objectives for today are to learn what a grade 2 lateral ankle sprain is, discuss the pathomechanics and cause of it, learn the clinical manifestations and functional limitations, learn about tests and measures that are most appropriate for the grade 2 lateral ankle sprain. We'll learn about conditions that present similar to that condition, and learn about the rehab process and likely outcome. So what is a grade 2 lateral ankle sprain? A grade 2 lateral ankle sprain is a partial tear of the lateral ankle ligament. The ATFL is the most commonly affected, but the calcaneofibular ligament can also be involved. With this condition, you can expect to see tenderness and pain at the ATFL and the CFL, also with moderate swelling. This individual will have difficulty bearing weight without crutches, and as far as instability is concerned, they may have slight instability or no, they might not have issues with stability at all. So as far as the incidence is concerned, the highest this condition occurs most often in individuals aged 15 through 19, and it's slightly more common in females. And nearly half of all the lateral ankle sprains occur from athletic activity, but there are many work-related causes. So this condition is typically caused due to a combination of plantar flexion and inversion. In plantar flexion, ankle stability is decreased as the narrow posterior portion of the talus is in the mortise. These forces stretch and tear the lateral ligament complex, leading to instability. If the inversion force is strong enough, this is where you'll see involvement of the CFL ligament. This type of injury often happens during sports that require cutting, pivoting, or sudden changes in direction, such as basketball or soccer, and it can also occur when someone lands on an uneven surface, like stepping into a hole or landing awkwardly from a jump. Individuals who have experienced previous ankle sprains or have chronic ankle stability are also more susceptible to this injury. The weakened ligaments from past injuries make the ankle less stable and more prone to re-injury. And then you have poor proprioception of the body's awareness of joint positioning can make it harder to respond quickly to unstable movements, increasing risk of sprain. Additionally, weak ankle stabilizing muscles like peroneals can reduce the ankle's ability to control sudden movements and protect the ligaments. So this is just a visual of what the position that the ankle will be in will look like if a person acquires this injury. So for the clinical manifestations and functional limitations, you can expect to see swelling, decreased range of motion, and gait abnormalities. The symptoms will be pain and tenderness, as I stated earlier, bruising, instability, and stiffness. And as far as the functional limitations are concerned, this person will have difficulty walking normally or climbing upstairs. They will have an inability to jump, pivot, or run. There will be challenges in standing for prolonged periods of time and difficulty walking on uneven surfaces. So, for tests and measures. To assess the grade 2 lateral ankle sprain, we can start with range of motion. This includes both active and passive range of motion in all positions, so inversion, eversion, plantar flexion, and dorsiflexion. We also want to do manual muscle tests of the muscles surrounding the ankle, particularly the peroneals and the gastroc complex. If we find weaknesses in these muscles, that will show functional impairments as well as guarding due to pain. As far as special tests are concerned, we can do the anterior drawer test or the tailor tilt test. The anterior drawer test tests the integrity of the ATFL ligament, and a positive result would look like, it would be a situation where there is excessive anterior displacement of the talus. And this would just be indicative of ligament laxity or a tear. As far as the tailor tilt test, this test is going to assess the CFL with the foot held and a neutral inversion of the ankle is performed, and increased motion compared to the uninjured side suggests that there could be damage of this ligament. In functional tests, we could do the single leg balance test or the hop test. The single leg balance test examines proprioception and stability, and the hop test is going to evaluate the ankle's ability to tolerate functional loads. And then we can always do imaging, so we can do X-rays or MRI. The X-ray is going to be used to rule out the fractures, particularly in cases with significant tenderness over the bone or an inability to bear weight. And the MRI is just going to provide a more detailed view of the soft structure, so this can either confirm the diagnosis that we already have, or it can identify additional injuries. So, now we're getting into differential diagnosis. There are a lot of conditions that can mimic a lateral ankle sprain. I just chose a few of them. So you have the high ankle sprain, the fractures, peroneal tendon injuries, or chronic instability. So for the high ankle sprain, this is going to be an injury to the syndesmotic ligaments that connect the tibia and fibula. Unlike a lateral ankle sprain, pain is often felt above the ankle joint, especially with dorsiflexion and external rotation movements. For fractures, fractures of the tibia or fractures of the fibula or talus can mimic the symptoms of lateral ankle sprain, particularly when there is a significant swelling or difficulty bearing weight. So this is where the X-ray will come into play, just to rule out the fractures. Then you have peroneal tendon injuries, which can occur with lateral ankle sprains due to the overstretching or subluxation of the ligaments. The pain here is typically located posterior to the lateral malleolus. And for chronic ankle instability, this results from repeated lateral ankle sprains leading to laxity in the lateral ligaments and poor neuromuscular control. Patient may report recurrent episodes of giving way, especially during sports or on uneven surfaces. So, for the rehab process and the maximum protection phase, the goals here are to reduce pain and swelling, protect the ligaments, and maintain mobility in uninjured structures. So we're going to provide rest and protection as needed. Then we'll move into some range of motion exercises. We can do ankle alphabet or dorsiflexion, but making sure that it stays within the pain-free range. Then we can do isometric strengthening of all the muscles of the ankle in all directions. And then we want to do cryotherapy, and we can do some pressure bandaging just to monitor, to control pain and swelling. All right, and then so in the moderate protection phase, the goals here are to restore full range of motion, improve strength, and enhance proprioception. So we can do some active range of motion exercises like seating or standing ankle circles and control inversion and eversion. Strengthening exercises with resistant bands, proprioceptive training, so we can do single leg stands or balance board exercises, and functional movements like pain-free walking. And then in the minimum protection phase, the goals here are to restore functional strength, dynamic stability, and prepare return to sports, activity, or everyday life. So we will start dynamic strengthening, advanced proprioceptive training, plyometric exercises, and if they're an athlete, you can start with the sport-specific drills. So for the likely outcomes, most individuals with a grade 2 lateral ankle sprain recover fully with appropriate rehab. They typically return to activity within 4 to 8 weeks. However, if the condition is left untreated, the residual instability may occur, increasing the risk of recurring injuries. Prevention strategies are crucial to avoid long-term complications and enhance ankle stability. These would include targeted strengthening exercises, as I stated earlier, proprioceptive training to improve balance and neuromuscular control, and wearing proper footwear that supports the ankle during high-risk activities. So an overview, a grade 2 lateral ankle sprain involves partial tearing of the ligament with moderate pain and instability. The injury typically occurs due to plantar flexion combined with inversion, often during high-impact sports or uneven landing. Clinical presentation includes swelling, bruising, and limited range of motion, assessed through physical tests like the anterior jaw test and talar tooth test. The rehab phase is focused on reducing inflammation, restoring strength, improving balance, and gradually returning to activity. And most patients recover fully within 4 to 8 weeks with proper treatment through prevention strategies, though prevention strategies are vital to minimize future injuries. These are my references. And
Hop test. I don't remember how to perform. How do you perform that?
so, basically what you're gonna do is you're gonna have the individual. Any more questions while I continue to look for tables? Go ahead.
Which sprain do you think is more common, lateral?
Lateral for sure. Just because the deltoid ligaments are gonna provide stronger stability on their medial side, so yeah, it's harder to tear those opposed to the lateral side of the ankle.
I was just gonna ask, because since you do say that lateral sprains are more common, how would you go about treating someone who has a reoccurrence of spraining their
So, the most important thing is going to be strengthening those muscles surrounding the ankle, just because they're weak, they've been injured a lot. So I think that's the most important thing, just making sure that you have strong muscles to prevent any type of abnormal movements, or if you do have those abnormal movements, your muscles are strong enough to keep everything in place. So this is a test that is performed by having the patient stand on one injured leg and hop continuously. And if the patient could not complete 10 repetitions of unilateral hopping without significant pain, this could also include a syndesmosis injury.